Hello, everyone. My name is Niels van der Geest. I'm a rheumatologist from Groningen in the Netherlands. And I'd like to thank you very much for inviting me on this very special day to tell more about my experience at Southend as a research fellow. Um, I was in Southend in 2018. Professor Dasgupta warmly welcomed me in Southend in his wonderful team and allowed me to participate in the GCA fast track clinic in Southend. I was only there for 3 months, but I really learned a lot. And one of the things, of course, that needs to be learned in such a fellowship is vascular ultrasound. And Professor Dasgupta and his team told me and taught me everything about it. And these are some images I was able to take from my patients in Groningen after I returned. And he learned me to look out for the halo sign in particular, the ultrasound halo sign, the black area around the blood flow. And after I returned home, we remained in contact and actually did a lot of research together. And we were able to publish together with a lot of other brilliant people a report on the Southend Halo score. And what we did is we combined all the ultrasound measurements from different arteries and combined them into a single Halo score. And this study would not have been possible without the help of so many patients from Southend who participated in the Bull study many years before. And what we found is that the Halo score is a very good diagnostic tool. And what we also found, and that was very new at that time, is that the Halo score, so the extent of inflammation on the ultrasound scan, is really, really strongly associated with the level of inflammation in the blood, with the amount of thickening of the arteries in the biopsy, in the temporal artery biopsy, and also with the occurrence of sight loss. And so, inspired by these findings, Professor Dasgupta, together with Alvin Sebastian and the rest of the team, started up a new project called the GCA study. I was also invited to join the study, for which I'm very grateful. And we hope to demonstrate in this study that the Halo score is very good for diagnosing GCA, but also can help with treatment monitoring during treatment. And we also investigate whether or not the Halo score at diagnosis is predictive of the treatment response later on during the disease. So this, we are really looking forward to the data, and I think it will be very exciting. When I think of Professor Dasgupta, I also think of the wonderful workshops that he organized in Southend, the international workshops, and later on during the pandemic, the virtual courses on ultrasound in GCA. Those workshops and courses have been critical platforms where all the people interested in GCA PMR could come together, and where ultrasound training was provided to many clinicians from all over the world. I think this has really shaped the field in the last decade. One workshop that I also remember is the one in 2016, where we discussed the plan to investigate the inflamed shoulders in patients with PMR. And Professor Dasgupta encouraged and inspired us to look into the inflamed bursa tissue in patients with PMR. And he recommended that we should use a new technique called ultrasound guided biopsy to collect these tissues from patients with PMR. He helped me in 2018 also with visiting the group in London who has been pioneering this technique in patients with rheumatoid arthritis. And based on this experience and with this encouragement, we were able to set up the Promise project in Groningen a few years ago, where we study these biopsies and apply a lot of state-of-the-art techniques in order to investigate the immune response in the shoulder and to identify targets for treatment in PMR. And this is how it looks like. On the left, you can see an inflamed bursa in a patient with PMR. That's the black, sac-like structure. And on the right, you can see here how the biopsy is going on. This is the needle. Now it's open. Now it's closed. The biopsy needle is gently removed from the wall of the bursa, and we take out a small biopsy from the needle, and we put it under the microscope and look at all the immune cells and immune proteins that are present in those biopsies. So again, I think a very exciting study and with a very prominent role of Professor Dasgupta. So with that, I would like to conclude, and I really would like to thank you, Professor Dasgupta, for all your help and inspiration and collaboration throughout the years. And I wish you a very happy and I guess also very active retirement uh, coming years. I hope you will find time to spend time with your family, with Dalia and the children, and also for your many other interests that I know you have. Um, I'm very happy to learn that you will not retire completely and that you will continue with research in GCA PMR. And I really hope to meet you again once the virus allows us to do so. I wish you a very nice day together with all the people here present, and really thank you and hope to meet you soon again. Thank you very much.